Hey everyone, my name is Daniel and I'm a mental health therapist located in Wisconsin. One topic that has been on my mind the past few days is just this large topic that people maybe talk about or they reference, but they're trying to figure out what is it, and that's the topic of resilience. So again, my name is Daniel Gospodarik and I'm the founder of Revitalized Mental Health based here in Kenosha, Wisconsin. And this topic of resilience is pretty large, right? A lot of questions pertain to what is it, how is it formed, how do we use it. So, just breaking down some of those questions. Resilience in a nutshell is just how do we endure and keep going, keep moving towards our values, keep moving towards the things that we care about despite adversity showing up. And then the question becomes is how is it formed? So some of the things I've seen for myself as well as for the people that I work with is, resilience is a lot of it is formed during childhood, or a great portion of it is formed during that adolescent childhood growing up period, right? When adversity hits, when we see things that are challenging to us, or maybe we see our caregivers going through some level of adversity, be it an illness, a chronic illness, cancer, or maybe they lose somebody that is close to them, and we see them kind of coping and moving through it and healing. So we witness it, right? We observe it, we see it modeled. Sports and academics can be another great way of how we form resilience. Some of the school subjects are pretty tough. Sports can be very challenging, right? But they also push you to perform at a higher level. So those are some of the ways too, right? Work ethic is a big part of resilience. Mindset is also another big part of resilience. Of what is the kind of self-talk that is inside of our own head to keep us moving forward when adversity hits. And we know just from this world, right, adversity will come. It's just a matter of time. So knowing what that is, and I do a lot of trauma work with men, and adversity or trauma, right, can happen to anyone. And then they're like, well, how do I use this resilience to move through it? Part of the fact of trauma is that, yeah, maybe that shouldn't have happened, right? And that's a fact, right? We don't wish trauma on anyone. But then it becomes of like, how do I heal? What do I need to do to start healing? Start moving towards my values while also taking care of my inner self. And that is where resilience in life is important, but also resilience in therapy, especially trauma therapy, is crucial. Because sometimes trauma therapy, it's not all just fun. It can get pretty heavy. Work through some really difficult emotions: guilt, shame, pain, vulnerability, regret, right? Survivor's guilt, whatever it might be. So that resilience in life can also be used as a very powerful tailwind in the therapeutic setting or in a trauma setting when you're healing. And that's one of the reasons this topic of resilience has been on my mind, because there's so much going on in our current society, in our current world right now, and B, people are still needing to heal, right? So just remember, like, when that adversity hits, the resilience is there, and we just need to lean into it and not avoid it, right? Lean into the adversity, excuse me, and not avoid it, because usually that just perpetuates the problem or the issue, and then it kind of has a compounding effect. So we want to lean into the adversity and address it versus avoiding. And people, that's a whole different YouTube clip of how do people avoid. But again, this topic was just on resilience, how it's formed, how do we maintain it by not avoiding things, and also leaning into adversity. So check out our YouTube channel if you want to listen to more short clips. But again, my name is Daniel, and I'm with Revitalize Mental Health. Thank you.